Hi guys, welcome back to my channel. It's the voice of Nurse Amarawizadegwe that you're hearing. In today's video, I want us to look at dangerous signs of diabetes, or simply the signs and symptoms of diabetes, and every point of this matters. I actually started this series just recently, and in the first video we discussed what diabetes is and also the types of diabetes. And for you to understand this one, I would like you to watch that one first so that you understand what diabetes is. It will help you to understand these signs that I'm going to call out now, because they are all embedded in what diabetes is. I will leave the link in the description box. You can also check it up here, click it and watch. Then you can come back and watch this one. Then the first sign of diabetes that most patients complain or that you should look out for is polyuria. Polyuria is medical name for excessive urination. That is the first one, excessive urination. When you notice that you are going to the toilet and you are just urinating, often you are urinating more than you used to do, is a dangerous sign that you need to be adequately checked. Then the second one is Polydyspia. Polydyspia is also the medical name for increased taste due to excessive loss of fluid, what leads to what we call osmotic diuresis. So when there is increased taste, when you have increased taste, then it can be it will be a clear sign that you have diabetes, because especially when this you know that you do not engage in any strenuous exercise, or you've not taken water for a very long time. This excessive thirst comes from you take water and the next minute you are thirsty, and also you need to rule out that you are not in a hot weather, a weather that makes you to drink water often. So when there is excessive taste to take water or to take soft drinks, then you need to check yourself. Then the third one is Polyphygia. Polyphygia is medical name for increased appetite. You found out that you are taking food more than you used to do, and you've ruled out you are not breastfeeding, you are not pregnant, as in you don't have any other thing that you can say that this is what is making you to have this increased appetite, or you are stressed up, or that you've not eaten since morning. So when there is increased appetite, you find out that you are eating more food than often, and it cannot be related to anything. Then the fourth point is unexplained weight loss. If you have been following this channel, you notice that most of the health conditions normally comes with unexplained weight loss. So when you cannot pinpoint your weight loss to anything, you do not do any strenuous exercise, you are not on portion control, there are so many things that you are not doing to lose weight, but you found out that you are losing weight, then is a cause for alarm. Then sudden weakness, then nausea and vomiting, sudden loss or change in vision. This sudden loss or change in vision is very important. In fact, is most time this is even what, like somebody will say that they are having eye problem and they will go to the ophthalmic clinic to see a doctor. Then they will be sent first to check their blood pressure and also to check their blood glucose. And sometimes you find out that either the blood pressure is high or that the blood glucose is high. So when there is change in vision, then you need to check your sugar, you need to go to hospital. Or change in vision, sudden loss of vision or sudden change in vision is also a clear sign of diabetes. Then another one is when you have dry skin or itchy skin, and this dry skin can be related to because of the excessive loss of water. When you have skin lesions can be, say you have small something like that looks like boil and the thing burst open, but you have been treating it and it seems as if it is not going, that it is not healing, or that you have something like a cut and the cut refuses to heal, then is a clear sign of diabetes. Then another one is recurrent infection. This can be seen most times in females that have recurrent yeast infection. Sorry, I forgot to write it here. Recurrent yeast infection. If you find out that you are treating yeast infection, which can be candidiasis, you are treating it, you go for a test, you go for culture, and every time they are giving you antibiotics, they are giving you antifungal medications to fight this, yet what is happening is happening. It may also lead for you to check your sugar level. And another one is numbness or pain in your feet or your legs as a result of nerve damage. I'm sorry for this wrong spelling here. As a result of nerve damage. So when you know that you do not hit your feet on anything, you do not hit your leg anywhere, and you have this sudden pain. Another one is being shaky. We find out that as in you started being shaky, and it feels like you are feeling so hungry or that you are feeling so weak. So this is also a sign. Then some people they will be so nervous, or sometimes they will be so anxious. So being shaky, anxious, and other of these signs can also be as a result of hypoglycemia, that is, the sugar level is low. So these are the signs of diabetes, and I say they are dangerous signs because most times before people present to the hospital, they may be at the stage of, as in the end stage of diabetes, when it must have complicated. So when you see any of these signs that I mentioned, it's very, very important that you go to your primary health care giver so that they will adequately check you and know what is causing all these signs. It's not every sign that you go to the hospital or that you go to the over-the-counter to get drugs to stop the sign. I encourage you to find out what is causing this. And having said that, thank you so much for watching. You can watch the first video if you've not watched it up to now, and also like my videos, subscribe to my channel, and share the videos to your friends. The next video we're going to talk about complications of diabetes. So see you then. Bye.